If you've ever tried to use your health insurance, you've probably had a moment where you thought, wait, what am I actually paying for? You pay a monthly premium. Then you still get a bill. Then insurance only covers part of it. And somehow, you might still owe thousands of dollars. It feels confusing. It feels unfair. And for a lot of people, it honestly feels like a scam. But the strange part is this. Health insurance isn't designed to feel simple. And once you understand why, the whole system starts to make a lot more sense. In theory, health insurance sounds straightforward. You pay every month so that if something bad happens, you're protected from massive medical costs. That's the promise. But the reality most people experience is very different. Instead of clarity, you get deductibles, copays, coinsurance, networks, prior authorizations, surprise bills, and none of it is explained in plain language. So people naturally ask, why is something this important so hard to understand? To answer that, we have to look at what health insurance is actually built to do. Originally, insurance had a very specific purpose: protect people from rare, catastrophic events. Things like major surgery, cancer treatment, and long hospital stays. Not routine checkups, not common prescriptions, not everyday care. But over time, health insurance in the US slowly expanded to cover almost everything. And that changed the entire system. Because once insurance starts paying for routine care, prices, incentives, and behavior all shift. Doctors bill differently. Hospitals charge differently. Patients use care differently. And insurers build complicated rules to control costs. That's when complexity explodes. Another reason health insurance feels so confusing is that the prices themselves often don't feel real. The number you see on a medical bill is usually not the number anyone actually expected to pay. Hospitals create large list prices. Insurance companies negotiate lower contracted prices, and patients are left seeing a confusing mix of both. So when someone looks at a bill and sees thousands of dollars for a simple visit, it feels shocking, even though the final amount paid may be very different. From the inside of the system, these layered prices are part of how negotiations and reimbursements work. But from the outside, they feel inconsistent and unpredictable. And unpredictability is one of the fastest ways to destroy trust in any system, especially one connected to something as personal as health. A big reason insurance feels so frustrating is this. Every dollar spent is being negotiated by multiple parties. When you get care, there are at least 3 groups involved. Each one has different goals. Patients want simple access, low cost, and clear answers. Providers want fair payment, fewer restrictions, and predictable reimbursement. Insurance companies want to control spending, to reduce unnecessary care, and to stay financially sustainable. The patient, the provider, and the insurance company. So, the system creates rules to balance all of this. Prior authorizations, network restrictions, step therapy, and coverage limits. From the inside, these rules are about cost control. From the outside, they feel like barriers. That mismatch is where a lot of frustration comes from. One of the most frustrating experiences in health insurance is the denial of coverage. A test, medication, or procedure that a patient and doctor believe is necessary can still be rejected by the insurance plan. From the patient's perspective, this feels arbitrary or even cruel. But inside the insurance system, denials are often tied to rules designed to control overall spending and prevent treatments that may be unnecessary, duplicated, or unsupported by certain guidelines. In other words, the denial isn't usually about one individual patient. It's about managing costs across an entire population. That doesn't make the experience less painful when you're the one affected, but it does explain why the system behaves in ways that can feel deeply personal, even when the decision was never personal at all. Here's another piece most people never see. Your monthly premium isn't just about your health. It's about everyone in the insurance pool. insurance works by spreading risk across thousands or millions of people. That means healthy people subsidize sick people, younger people subsidize older people, and low users subsidize high users. Without that sharing, insurance would become unaffordable for the people who need it most. So insurers constantly adjust premiums, deductibles, networks, and coverage rules to keep the math working. That math is invisible to patients, but it drives almost every decision in the system. Even though these decisions are mathematical and systemic, they feel incredibly personal when you're the one getting a bill. Because healthcare isn't like buying a phone, a car, or a flight. You usually don't have time to compare prices, clear information, or the ability to walk away. You're often dealing with pain, fear, or urgency. So, when insurance denies something or a bill arrives unexpectedly, it doesn't feel like policy. It feels like someone failed you. And emotionally, that makes perfect sense. This is the big question. If something is this confusing, this expensive, and this hard to navigate, is it actually a scam? The more accurate answer is this. Health insurance isn't designed to be a scam, but it is designed to manage risk, control costs, and balance competing incentives across an entire healthcare system. And when you experience that system one bill at a time, it can absolutely feel unfair. Not because someone is secretly trying to trick you, but because the structure itself is incredibly complicated. At this point, a natural question emerges. If the system is this complicated, why hasn't it been simplified? The answer is that every part of the complexity exists for a reason, even if that reason isn't obvious from the outside. Rules are added to control costs. Regulations are added to protect patients. Benefits are expanded to improve access. And each new change interacts with everything that already exists. Over time, the system becomes layered rather than replaced. Not because people want confusion, but because large systems rarely get rebuilt from scratch. They evolve piece by piece. And evolution, especially in healthcare, almost always creates complexity before it creates clarity. None of this makes surprise bills less stressful, and it doesn't make premiums feel cheap, but understanding the why behind the complexity can change how the whole experience feels, because confusion often feels like chaos. But once you see the structure underneath, you start to realize there's a system here, even if it's far from perfect. And the more we understand how complex systems actually work, the easier they become to navigate. There's also something else that makes health insurance uniquely difficult to understand. Most people only interact with it during stressful moments, when they're sick, worried, or trying to make fast decisions, and systems that might feel manageable in calm situations can feel overwhelming when time and clarity are limited. That doesn't mean people are confused because they aren't paying attention. It often means the system is being experienced at the exact moment when understanding is hardest, which is why clarity in healthcare isn't just about better explanations. It's about designing systems that still make sense when people need them most. And the more we understand how complex systems actually work, the less powerless they begin to feel. Because confusion isn't always chaos. Sometimes it's just complexity we haven't learned to see yet.